My name is Dr. David Benversi. Let me share with you one of the tips on how to avoid a permanent injury from an auto accident. The first tip we're going to be talking about is the taking or the use of NSAIDs when you're going through your phases of healing, and how that can potentially lead to long-term damage or long-term inabilities or not being able to heal all the way. So when you are in an injury or have an injury, you have basically three phases of healing. The first phase is going to be your inflammatory phase, the second phase is going to be your repair phase, and lastly we're going to have the remodel phase. Now during that first phase, which is the inflammatory phase, the use of NSAIDs or the non-steroidal anti-inflammatories is something that we could and recommend using. However, when we transition into that repair phase after the inflammation has gone down, our body starts to naturally produce collagen, which is our body's natural way of repairing that tissue that's been damaged during that accident or during that injury. Now, if we continue the use of those NSAIDs during this repair phase, the NSAIDs themselves actually reduce the amount and the quality of that collagen that your body is able to produce. So what that really means to you is that the strength and the elasticity of that collagen or that new tissue that's being repaired is not going to be where it needs to be. We're going to have a decrease in strength and elasticity. So if you've been in an auto accident or in pain, give our office a call. We'd love to help. 618-519-9334. My name is Dr. David Benversi, and I'd like to share with you one of the tips on how to avoid a permanent injury when you have an auto accident. And that tip is to be able to be aware of the three phases of healing that our body naturally will go through during an injury like an auto accident. That first phase is the inflammatory phase, then we have the repair phase, and lastly we have the remodel phase. Now, during the inflammation phase, our main goal is to decrease the amount of inflammation and also decrease the pain in that area, and that should be the main goal of whatever technique or use or whatever you're doing during that inflammation phase. Then when we move into the repair phase is going to be geared towards more or less increasing the range of motion and making sure that the joints are able to have all the ranges of motion that they need. So there's three main ranges of motion that we need to be able to address during that repair phase, which is the active, passive, and joint motion, which chiropractic is really the only profession that addresses all three of those ranges. And the importance of the physical medicine side of things in the repair phase is very essential, because if we don't have that, basically we're going to be left with decreased range of motion. The elasticity in those areas is not going to be where it's going to need to be, and we're also going to have more pain fibers in those areas as well. Then that leads us to the last phase, which is the remodel phase, and during this phase it's going to be important for us to work or concentrate on strengthening the muscles and the ligaments in those areas, and also making sure we're stretching and making sure we have the range of motion or the elasticity that we need in that last remodel phase. If you've been in an auto accident and are in pain, we'd love to help. Give our office a call at 618-519-9334. My name is Dr. David Benversi, and let me share with you one of the tips to avoid a permanent auto injury. And that tip is basically the importance of having physical medicine during the repair phase. Now let me explain a little bit about that. There's basically three phases of healing in any injury that we have. We have the inflammation phase, we have the repair phase, and we have the remodel phase. Now quickly about the inflammation phase, that's obviously right after the injury. As soon as we get over that inflammation phase, we're going to be going into the repair phase. And basically our goal as chiropractors or any person that deals with physical medicine during that repair phase is to increase your range of motion. And that's going to be in three different categories. It's going to be in the active, passive, and joint ranges of motion. Now let me explain just a little bit about those. The active range of motion is basically how far you can actively move that joint or that range of motion yourself. The second thing would be the passive range of motion. So that's basically having some type of assistance or therapist bring that joint into just a little bit past that active range of motion. And lastly is the joint motion, which is something that chiropractors specialize in specifically, and that's bringing it past that passive range of motion and restoring that motion even further. Now, if we do not have all three of those ranges of motion restored, we have a high likelihood of having a permanent injury or things not repairing and being healed the entire way. So, and with that tissue not being healed all the way, we're looking at a couple different consequences. One of the things is we're going to have an increased likelihood of re-injury to that area, and we're going to have a decrease in the range of motion. We're going to have stiffness in that area, and we're also going to have an increased sensitivity to pain in those areas as well. So if you've been in an auto accident and are in pain, please give our office a call at 618-519-9334. My name is Dr. David Benversi, and let me share with you one of the tips to avoid a permanent auto injury. And that tip is having physical medicine during the repair phase of our healing. Most importantly, dealing with the strength of that collagen and what's being repaired in that particular situation. So just to explain a little bit, we have three phases of healing when we're dealing with any type of injury. We have the inflammation phase, we have the repair phase, and we have the remodel phase. The inflammation phase is more of the pain and inflammation, and that's something that's going to take a shorter period of time. But as soon as we move into that repair phase, that's where our body starts laying down the collagen, or basically the repaired tissue in those areas of those injuries. Now, if we do not have any outside help as far as a physical medicine, that collagen is not going to be nearly as strong. It's going to be about 70% the strength of what the original tissue was. So that's going to be a huge difference. And what that will eventually lead to is re-injury in that area, not having the strength to withhold the stresses that you'd put through that tissue. Now, with some type of a physical medicine such as chiropractic, we work on that tissue or that collagen when it's being laid down, making sure that we're increasing the strength and improving that strength to almost at normal or as close to normal as possible. So again, if we do not have that physical medicine during that repair phase, it's going to decrease the strength of that collagen. So if you've been in an auto accident and are in pain, we'd love to help. Give our office a call at 618-519-9334. My name is Dr. David Benversi, and I'm going to share with you a tip about how to avoid a permanent auto injury. And that tip being making sure that you're getting the physical medicine you need during the repair phase, for the simple fact of the lack of mobility or the elasticity that is important during that repair phase. So let's first of all take a step back and talk about the three phases of healing. The first phase is the inflammation phase, then we have the repair phase, and lastly we have the remodel phase. The inflammation phase is normally fairly short, and that's obviously where we're having most of our pain and inflammation. As soon as we get into that repair phase, that's where our body naturally starts to produce collagen and basically lays that collagen down to help and start repairing that tissue. Now, one of the main things during the repair phase is making sure that you're having some type of a physical medicine, such as a chiropractor. And the reason why that's important is the elasticity in that tissue if we don't get that physical medicine. So again, when we have the physical medicine during that repair phase, we're going to be able to increase the elasticity and try and repair that or get that as close to normal or even to normal during that repair phase. However, if we are not getting that physical medicine during the repair phase, we're going to have a decrease in the elasticity, which long-term consequences of that is we're going to be a lot stiffer. We're not going to have the mobility that we need, and we're also going to be setting ourselves up for a re-injury or pain and problems down the road. So if you've been in an auto accident and are in pain, we'd love to help. Give our office a call at 618-519-9334. My name is Dr. David Benversi. I'd like to share with you a tip on how to avoid permanent injuries when you have an auto accident or auto injury. And that tip being the necessity or the fact of getting physical medicine during that repair phase, for the simple fact of the amount of nerve endings or the amount of nerves that get deposited in that tissue during that repair phase. Now let me take just a step back and explain the three phases of healing. The first phase is the inflammation phase, the second phase is the repair phase, and the last phase is the remodel phase. Now in that repair phase, like I was saying, our body naturally starts to produce collagen that gets laid down on that injured tissue and tries to basically heal and repair that injured tissue as much as possible. Now if we don't have any outside physical medicine such as a chiropractor helping out during that repair phase, the amount of nerve endings, the number of those nerve endings is increased dramatically. So what that basically means to you is that down the road, things such as your activities of daily living, such as taking a shower or lifting something up that in the past hasn't given you pain or discomfort, might now start to give you pain or discomfort because of those increased the increased amount of nerve endings in those areas. Now, with the help of physical medicine such as chiropractic, we essentially help reduce the amount of physical number of nerve endings in those tissues. So what that really means for you is that long term, you're not going to be experiencing the pain and discomfort. You're going to be able to load those tissues with the same amount of weight or whatever you might be doing as you did beforehand, or get you as close to that as possible. So if you've been in an auto accident and you're in pain, please give our office a call at 618-519-9334. My name is Dr. David Benversi, and let me share with you a tip on how to avoid permanent injury when you have an auto accident or auto injury. And that tip being the importance of having physical medicine during the repair phase, and the reasoning for that of not having permanent pain or permanent discomfort in those injured areas. Now let me explain a little bit about that. Basically, our bodies go through 3 phases of healing when we have any type of injury. We have the inflammation phase, we have the repair phase, and we also have the remodel phase. Now, in that repair phase specifically, when our body starts to produce the collagen to help and start repairing those tissues in those areas, the sensitivity to those nerves are naturally much higher and much elevated because it's already an injured tissue in that area. And what that really means for you is, if that tissue is not treated at all, you're going to have increased pain sensitivity, and things such as your normal activities of daily living are going to cause you pain, and you're going to not be able to load those tissues as much as you did before the injury. Now, with the use of physical medicine such as chiropractic, we can help effectively reduce the sensitivity of that tissue and bring it as close to normal or back to normal as possible. And what that really means for you is that you're going to be able to go through those activities of daily living again, like showering or tying your shoes, putting your pants on, things like that, without having that pain associated with that. So if you've been in an auto accident and you're in pain, please give our office a call at 618-519-9334.